Cool. So knee workshop. The basics that we just want to like hit from the beginning are potential reasons why you're experiencing knee pain. So basically what it's going to come down to is tight muscles, immobile muscles that are pulling one way or the other to putting tension on them. Weak muscles and or tendon, like structural damage. So I am not licensed, I am not safe to really deal with the structural damage stuff. So we're gonna just address the flexibility and the strength issues, because yeah, that's all I'm really capable of addressing. So let's first kind of take a look at the length of the muscle. So basically what you're going to have is, if you have something that is tight on the outside of your leg, it's going to pull your knee out. If you have something that's tight on the inside of your leg, it's going to pull your knee in. Basics, it makes sense. Where your calves come in is if you have tight calves and tight ankles, then you're not going to have the strength and mobility to support your weight, therefore put more pressure on your knees. All that making sense so far? Thumbs up. Cool. So how do we stretch and lengthen everything in order to get back to a baseline? That's where your foam rolling comes in. Really paying attention to foam rolling your calves specifically, your hamstrings, and then the top of your quad. Because again, I didn't mention it, but it makes sense. If your quad is tight, it's going to be pulling upwards, which is then straining the kneecap, which is then straining the whole knee joint. So, fun little side story, I had a gymnast whose quad was actually so tight that she split her patella. She split her kneecap. And we were also confused because certain things hurt, certain things doesn't. And when it hurt was when she was squeezing her quad. Like, she could still lunge, she could still do everything, but it hurt when she squeezed her quad because her quad was literally pulling her bone apart. So, strong quads are good until you break your kneecap because of it. So again, reminders on foam rolling. You're wanting to go slower than you want to, and you're wanting to lay the roller parallel to the muscle you're working and slowly manipulate it up and down. Second step of stretching and lengthening, quote, that muscle is going to be the actual stretching. That's where your calf stretches come in here, so bending and flexing to really figure out where to get that stretch through the calf. Another really good way to do it is use your band, which we'll use later. That out so you can see, just loop it around your toes and then actively pull your toes back towards you. Can you see that? And here. And then turning back and forth here. Hamstring stretches, those are your traditional, just bending and folding over. Yeah, exactly, Lauren. So hamstring stretches, your traditional bending and folding over. But then part of the reason why we've got Kendall doing yoga for us all the time is because those down dogs, dude, just drop into that down dog, and there is your hamstring and calf stretch right there. So walking that dog, manipulating it, moving it around, the taller you lift your butt, the bigger stretch you're going to get, okay? And then your standard quad stretch right here, trying to pull your knees together and down to really release and extend that quad, okay? So foam rolling and stretching and lengthening your muscle is really going to be the baseline for starting to attack knee stuff. Any questions on that? Hopefully you can still hear me because you're frozen on my end.
I can still hear you. Can you hear me?
I can.
One thing that I have found through my knee issues is stretching my IT band helps.
Yes.
Could you provide some of the stretches that you do for that?
So my favorite IT, and somebody who's been in the industry longer than me and has done more education than me once told me that actually foam rolling your IT band is like trying to foam roll a truck tire. They're just that tense and they're that tight naturally. So that's where that piriformis stretch where you're on your butt comes in. So I'll remind us of the piriformis stretch real quick and then I'll get into some IT stuff. So reminder, the piriformis stretch, your knee is up, your elbow is down, and you're right here. So you're not up onto your IT band, which for those I like to cross. I think I lost you. I'm going to wait a second. Am I back? Do you got me? Cool. All right. So in a standing forward fold stretch, all you're going to do is cross left over, right over left or left over right, and then do the same thing. And what that's going to do is stretch through the outer leg on the outer thigh on the one behind. Yeah. So then kind of lean over and stick out that butt a little bit. There you go. You found it. So that's my favorite IT stretch, is right here. There was another one that I'll ask Kendall about in yoga that we did, which is not this one, but taking from that down dog, taking it around and behind, similar action right here. So yeah, that's kind of the best IT stretches that we've got there. Are you feeling it there? Did that help? Cool. Anything on muscle lengthening and stretching? Anything else?
So you're saying I'm having a lot of problems on the inside. Mm-hmm. So you're just saying that is from tight muscles around that area?
Correct. And where I'm going to the next part, that's where you're going to get muscle imbalances and weaknesses. So if it's on the inside that the pain is, it's most likely because the exterior, hold on, let me make sure I'm saying this right. The pain is in here, right? So then the interior is weaker than the exterior, causing it to drop in and then pull at a funny angle. So if I'm squatting and my knees are coming together like this, the inside is too weak, the outside is stronger, and that's where I'm getting the tension through the center. Does that make sense? So that combined with the muscles being tighter and pulling them out, but then they're weaker, so then they're dropping in, that's where we get that push and pull, which results in the pain. Okay, make sense? Yes or no? Cool. So, I mean, that led naturally into the other side of the knees. So, like I was just saying, if the exterior is stronger, you're probably going to drop in here. And if the interior is stronger, you're going to probably pull out there. So, how do we strengthen without putting pressure on our knees? And the same thing goes for more of a frontal, if the quad is too weak and the hamstring's too strong. Basically what you're looking at is whatever is strong, the weak side is going to have the pain. So, by strengthening the whole thing in a way that doesn't put pressure on it, that's where you're ultimately going to see the most success. So, we'll go ahead and start. And if you want to participate in any of these and kind of just see how they feel, please do, or you can just observe today. So we're going to start with strengthening the quad without putting additional pressure on the knee. And the simplest way to do that is just to lay down on your butt. I like to kind of go back down onto my elbows a little bit, lift and lower a straight leg. So it's not going to feel like you're doing much, but you're actually getting a gentle stretch on your hamstring and calf while working that quad. So if you're doing along with us, go 4 or 5 on one side, and then go ahead and switch and go 4 or 5 on the other. So again, the goal here is to strengthen the structure around the knee to be more supportive of the knee without putting additional pressure on it. So, next phase of that is going to be simply sitting in a chair, simply sitting on a stool, whatnot. And now we're doing the exact same thing, but with flexion and simply extending and releasing that muscle. So again, we're moving from the least stress on your knee by keeping it straight to slightly more stress on your knee by adding that flexion. Again, 3 to 5 on one side, 3 to 5 on the other. Cool. And I just have to laugh because the way that my brain processes things, it's like, well, strengthen the muscles, they're more stable, but you forget about these littler moves, quote, that make a lot of difference. So just progressing up in the chain of difficulty as far as pressure on the knee, we're going to come down essentially to the same position at the first, but we're going to loop a band around our knee, put some tension on it, extend, release. So now essentially you're doing the squatting motion, but without the additional body weight to, again, just strengthen that knee without additional pressure on it. 3 to 5 one way, 3 to 5 the other. Any questions on quad strengthening for knee health? Nope, sounds good? Cool. One question that I know will come up eventually, how many, how long, any rehab and recovery that you do, unless it's a significant injury that you're rehabbing from and can't do the other workouts, as long as it's just a minor annoyance that you're working through, you're just looking to 5 to 10 minutes a day. It shouldn't take much time out of your routine, whether you put it in, and have it, stack it wherever it works best for you. If it's a get up in the morning, make your coffee, go sit and do this for 5 minutes while your coffee is brewing, move along with your life, or similarly to going to bed. Before you brush your teeth, sit down, spend 5 minutes doing some rehab and recovery. But again, no more than 5 or 10 minutes. If it's taking more than that, then your injury is probably more significant and we need to address it otherwise. So we're going to go to the muscle in opposition, now to the hamstrings. We do a lot of these. We already do the hamstring booty curls right here. Again, it's simply taking it out of the workout and putting it into a rehab setting. So really just making sure that both those hamstrings are strong enough and flexible enough to reduce the pain that you're feeling. We're not going to spend too much more time on hamstrings because really that's kind of the extent of it. Moving on to adductors and abductors. So I will teach you my very simple way to remember which is which. The adductor is on the inside of your thigh because you're adding to your body when you pull it together. That's the way that my brain thinks about it. So I am adding to my body by pulling it together, and then there's really not a fancy one. It's just abduction, out, add, okay? So again, simplest is going to be the ones that don't involve movement and therefore don't put excess strain on the already sensitive area. So for your adductors, inner thigh, simply your inner thigh leg lift. Again, we do them within the workout moderately often. It's just simply taking them out and pulling them into a rehab setting. Okay, so right here, again, throw on YouTube, throw on a sitcom, whatever you're watching these days, just lay here and do a handful on either side to get that adductor. Another one that we do often for the adductor is in the glute bridge, but again, that's going to put more strain on your knee. To avoid the strain, simply take your band, attach it to something that is stable, which I'm not easily finding at the moment. Here, make your loop, and then it's going to be the same motion. Now you've just added some tension, crossing your body. And actually my inner knee tweaks a little bit when I do this one. So also adjusting the positioning of your foot will change it. Inner toes pointing in pigeon or out, either way will change it. But when you're ready to advance to a little more resistance, you can go right here and then go both sides. Gee. The most advanced, obviously, then is going to be with flexion and with weight, and that's where you lift here and pull in and out. Or again, it can be done the most advanced, because then your weight bearing as well is going to be up off of a block, going in and out here, and then adding a band. Okay. Next, any questions on adductors, inner thigh? Good? Cool. So, again, following your same pattern, your abductors, the outside, that's where your standard leg lift is going to come, right here. To advance that, grab a weight, throw it on your leg. Super simple, just lay it down on your thigh. And then you can also do the same thing that we did, the band over here, just now facing the opposite direction and pulling outward. So I'm going to be pulling out here, okay? Another one for that is going to be either your banded or unbanded soldier walks. These are Marina's favorite. She's done hours of these with me. To do it banded, all you're going to do is wrap the band around the exterior of your feet. Scooby-Doo, untie this a second. Okay. Some pointers. I'm actually going to bring this in close on my feet just so you can see a second. So what you're looking for is, if this is parallel, this is externally rotated, you want your toes slightly internally rotated. And then it's not picking up your knees. Your legs are staying as straight as possible, and you're just shuffling. So then with the band, it would look like this. Toes internally rotated, putting pressure on the band, and just little pigeon walks side to side. And I'm actually being a very poor example because my butt is sticking out. You really need to pull it in and up through here. So it should feel like you're in a plank. I'll pull this back up so it's a little easier to see my core again. Again, we talked about this last week. It should feel like you're in a plank. Pulling it in and up and through the entire time should feel like a plank. Okay? Now, perhaps the two most advanced, but potentially the most bang for your buck, if your body is able to do them, is going to be slow-mo step downs and banded single leg squats. So your slow-mo step down, need to make sure camera's in the right place. This is going to be where you're off the side of a bench, and I'm actually going to go this way so you can see my working leg. You're off the side of a bench here, and my bench is almost broken and starting to wobble. Keeping your hips as level as possible, simply lower and lift back up. So from the forward view, it's going to look here. And again, we've done these in the workout, just not with as much specific intention. Just lower and lift here. And if I pull the camera up a little bit, I'll show you the hip position. So, balance. We don't want that hip to shut. So if you look at my t-shirt line here, see how it's at an angle versus holding flat. You need to be able to pull it up and down while holding it flat, okay? Start holding a wall. Put your foam roller next to you, and maybe it's just enough to do a micro bend and just kind of try to balance there a second. Notice what that knee is doing. Is it tracking in and out? Is it pulsing forwards and backwards? Because that will also give you hints about where and what needs to be strengthened. Okay? Any questions here? Still good? Cool. So the last one, which is going to be the more advanced, and which is quite honestly easier to do with a partner, but I'll do my best to show you without a partner. Where's it gonna move? Over here. Maybe. No, you can't see me very well. Okay. I'll just do it on the chair and do my best. So what you want to do is you want to take a band that you can place just below your knee. Again, it's easier and better if you have a partner who can help you with this, because if the band is around my knee here, that partner can give more or less tension to create instability, right? Because I don't have someone here to help me, I'm just going to use the chair. But then the move is going to be similar to that which we did off of the edge here. So you're going to put your knee in and then put tension on it. So it's going to be trying to pull your knee around, and you're simply going to try to reach down to your toe, bending as much through that knee as possible. So your knee has to be pulling inward, strengthening the inner thigh, because the band is trying to pull you back, okay? And without the band, just because it's hard to hold on to the chair and the band at the same time, the move that you're going for is slightly kicking back the opposing foot, but then bending down. Actually, I need to do it on this side because that's my not great ankle. Bending down as low as you can, and then pressing back up, okay? Hold on to something. Bending down as low as you can without pain, and then pulling back up, okay? And the last thing that I don't remember why, actually, before we move on, any questions on that one? Sounding good? Cool. Oh, wait, good.
So for squats, most times we're trying not to let our knee go over our toes. Is it the same for those exercises where you're doing single leg?
This is different. And the old adage, knees over your toes, everybody squats differently. I squat, my knees go decently over my toes. And that's, I lunge, and yeah, on a lunge, it's a little more important to keep it back. You don't really want to press it forward on a lunge, but, and I know it's not the squat day, but I'll just give you a sneak preview. I need to find a book that's the right height. Find something about a weight plate's thickness. And again, Marina, you'll probably remember this. Toss it under your heels. Because the squat, again, we're going to do a full squatting day preview. Squat, you hinge in 3 places. You move in 3 places. You move in your ankles, you move in your knee, and if you move in your hips. If any one of those parts don't work well, it's going to affect the strength that you're able to build, the stability you're able to build, and the function of everything else. So, my ankle doesn't move after a lot of stuff. So by simply putting, and I'll just show you, I can squat to here without putting pain and tension in my ankle. I can get all the way down, it just puts pain and tension in my ankle. I put my heel up, I can get to here without pain. So, again, doesn't mean don't put your toe over, but the toe over is simply more mobile ankles. And so you're probably compensating somewhere else for the more mobile ankles and the stiffer hips or stiffer knees. So your knee doesn't move, your ankle's going to compensate. My knees move fine, my ankle doesn't. The compensation has to go somewhere. Okay, So the last one, which I don't have a good example of because I don't, is find an unstable surface. So I guess the best example that I have of that right now would be a pillow. So by standing on a pillow, you're going to be more wobbly, right? So now this knee has to work harder to keep you stable. Just try, and you can see it moving around all over the place. Try touching over to the side. Try reaching in front. Try reaching to the side. So by simply creating an unstable surface, a foam pad, if you have a Weeble Wobble, since we're at home and we don't have those things, pillows. So you've got your body weight as tension, but you're not actually flexing through the joint. You're simply creating an unstable surface to activate the stabilizers within the structure. Yes? Cool. Awesome. What else you got? What other questions did that cover? What you were needing? Does that make sense? What do you got for me? Anything? Oh, so the last thing that I wanted to say, which is a topic I don't bring up much, but it affects this, is weight and pressure on your joints. It's simply a fact. The more mass you're carrying, the more pressure that is going to be placed upon your joints. So, I absolutely am never going to tell anyone to lose weight. I'm not. However, for things like chronic disease, achy joints, things of those nature, the science simply says if you are carrying more mass than your body is able to support, that is where you're going to have those issues. So, again, it's not for not everybody because everybody's bone structure is different. And you're lucky that by doing the weight training and some of the plyometric training, some of the jumping training that we're doing, you're actually increasing the mass of your bone density, which then you can support more. What that doesn't necessarily do is help the joints and the ligature. So that's, again, where getting better posture, making sure you're strengthening the micro muscles around it are going to make the difference. Yes? Cool. You got anything else for me before we stop recording? I'm going to take that as a no. Thank you guys. Hope you guys got something out of this. I'm going to hit stop.